Welcome back to Great Day Washington. We often look back on history to learn how to handle current and future events, and that is no different than what leaders are doing right now to help fight the coronavirus. I decided to ask a former Obama administration official who led the fight against the Ebola outbreak how she thinks the nation is doing right now combating the coronavirus. Gayle, thank you for joining us here on Great Day Washington.
Thanks so much for having me.
The time you hear people referring back to the most right now, back to 2014 with the Ebola crisis, and I know you are one of the lead people taking us through that period of time. Have you been thinking back to then right now?
Oh, all the time. All the time. There's so many lessons that came from that emergency in terms of what we need to be doing now, that it's been, I think, very informative, in many ways, very helpful, because we learned so much about how to manage a health crisis like the one we're seeing now. So it's very, very prominent in my mind.
For this to be a global pandemic as well, and I know you have expertise in this area that go so far and wide, how important is it for us to be working globally with everyone to make sure that we're handling this?
It's critically important. And I understand that it's very difficult right now because obviously all of us in Washington, D.C. or this area are focused on what's happening here. We're concerned about friends and families and the economy and jobs and everyone's health. But the fact of the matter is this virus doesn't need a passport. It doesn't need a visa. It moves freely across borders, as we've seen. So it's in our interest to be working globally with other partners to make sure we can defeat this pandemic, not just within our borders, but externally. It's also, I think, an important thing, U.S. leadership in these areas is something the rest of the world counts on and believes in. And as we saw during the Ebola epidemic, the fact that the U.S. stood up to really marshal more global cooperation led to a lot more countries joining with us. And in fact, a partnership between the international community and Africa that led to the defeat of that epidemic. So it's the right thing to do, but it's also a really smart thing to do.
Is there anything, speaking of U.S. leadership, that you wish the administration or perhaps Congress would do, some action you think they need to be taking in order to handle all of this?
I think there are a couple things, and I will say that on the congressional side, and here, interestingly and importantly, there's a real bipartisan consensus. There's a long history of many, many years of Democrats and Republicans working together on global health more broadly. So the fight against HIV/AIDS, malaria, TB, all of those things, there's been a real political consensus. And there's still an interest and awareness now, I think, on the Hill that we need to be focused on the global as well as the local. What I'd like to see is the United States joining in more of the international fora that are being stood up. There's a lot of work being done now on how do we make sure that vaccines and therapeutics, when they become available, are available globally. And again, it's the right thing to do, but it's also smart because we can't defeat this at home if we're not also defeating it abroad. And I hope that the agency I had the privilege to lead, the U.S. Agency for International Development, USAID, is able and empowered to really lead on this. They did a terrific job during Ebola, and they can contribute quite a lot. So I hope we'll see more of them.
Speaking of Ebola, I had told you I was a reporter in Dallas during that time. And for me, covering this, the coronavirus feels very different than Ebola. Was it different for you as well? I know that was your entire life for 13 months.
It's different. I think that the Ebola epidemic, and particularly you were in Dallas, so you know this very well. When there was an actual case in the United States, and then we had 2 frontline workers also infected, and then we had American healthcare workers come back, one of whom, Dr. Craig Spencer, is now working in New York City on the coronavirus pandemic. I think it brought it home to people that these viruses can move across borders. I think it really scared people. And for quite some time, we saw a lot of support across the United States for doing what we needed to do externally, both to help people in West Africa, but also to serve our own national security and other interests. I think I wish that some of that understanding had been retained. I think as with so many crises, one passes, the next one emerges, and sometimes we forget what's just happened. But as I said at the outset, there's so much to be learned, even though it was very different, so much to be learned from it about how we need to proceed now.
Absolutely. We can always learn from our past. Gayle, I could talk to you forever, but unfortunately that's all the time we have. Thank you for joining us here today.
Thank you, and thanks for keeping the news on in D.C.
I literally could have talked to Gayle Smith all day long. We talked for a while after we stopped recording. In fact, she's fascinating, she's smart, and she's genuinely easy to talk to. Thank you for sharing us a bit of the past and how it applies right now.